Hello, and welcome to another video. In this video, we will be discussing hand, foot, and mouth disease. Hand, foot, and mouth disease is a common viral illness usually affecting infants and children, but can affect adults. If your child has developed a sore throat, a fever, and a rash around the mouth, hands, and feet, they might have something called hand, foot, and mouth disease. So, whether you're a concerned parent or just curious about this fascinating disease, watch on to learn more. Hand, foot, and mouth disease is a viral infection. It is most commonly caused by the Coxsackievirus of the Enterovirus family. These viruses can enter the body through the mouth or nose, and cause symptoms like fever, sore throat, and a red rash or blisters on the hands, feet, and around or in the mouth. The virus can also spread to other parts of the body, including the buttocks and genitals, through contact with the fluid from the blisters or with contaminated objects. It should not be confused with hand, foot, and mouth disease of animals, which is caused by a different virus. Initial symptoms of hand, foot, and mouth disease may be vague, and your child may complain of feeling unwell without specific signs. These include a sore throat, a high temperature, typically greater than 38 degrees Celsius or 100.4 Fahrenheit, raised glands in the neck, a headache, abdominal pain, vomiting, and fatigue. After a few days, the second stage of hand, foot, and mouth disease usually starts, and this may present with a raised rash of spots on the hands and feet, around the mouth, and sometimes the thighs and bottom. Painful ulcers within the oral cavity make your child reluctant to eat or drink. Before we continue, I wanted to let you know about our free AI symptom checker over at mychildshealth.io. Our trained AI symptom checker allows you to enter your child's symptoms, and it will then come up with a list of possible causes, allowing you to explore our articles to find out about the various conditions and understand your child's symptoms. Why not check it out today? A link is in the video description. Diagnosing hand, foot, and mouth disease typically involves observing the characteristic symptoms and conducting a physical examination. The healthcare professional will examine the rash or blisters on the hands, feet, and around the mouth, and check for other accompanying symptoms like a fever or a sore throat. Combining the history and physical examination, a diagnosis of hand, foot, and mouth disease can be made without any further investigations. Suppose you suspect you or your child may have hand, foot, and mouth disease. In that case, it's best to visit a healthcare professional for a proper evaluation and guidance on managing the symptoms. Currently, there is no specific treatment for hand, foot, and mouth disease, as it is caused by a virus. However, there are steps you can take to help manage the symptoms and promote a speedy recovery. It's essential to focus on relieving discomfort and preventing dehydration. Over-the-counter pain relievers can help reduce fever and alleviate pain associated with mouth sores and painful blisters. Antihistamines may also provide some benefit if the blisters are itchy or if there is an associated viral rash. Consuming cool or soft foods and beverages can relieve a sore throat and make eating easier. Additionally, staying hydrated by drinking plenty of fluids is crucial. Be sure to rest and practice good hygiene to prevent the spread of the virus. Most cases of hand, foot, and mouth disease resolve on their own within a week or two with these supportive measures. If you have any concerns or symptoms worsen, it's always best to consult a healthcare professional for guidance and advice. While hand, foot, and mouth disease is generally a mild and self-limiting illness, in some cases, complications can arise. One of the main concerns is dehydration, especially if a person has difficulty drinking or eating due to painful mouth sores. It's essential to ensure adequate fluid intake, offer hydrating fluids, and seek medical attention if signs of dehydration, such as decreased urine output or excessive thirst, are observed. Rarely, hand, foot, and mouth disease can lead to complications such as viral meningitis or encephalitis, which involve inflammation of the brain or its protective membranes. These complications may cause symptoms like severe headaches, neck stiffness, sensitivity to light, or changes in behavior. If any of these symptoms occur, immediate medical attention is necessary. Secondary bacterial infections may also occur due to broken blisters or open sores, leading to skin infections or other localized infections. Suppose you notice signs of infection, such as increased redness, warmth, swelling, or pus. In that case, it's essential to consult a healthcare professional for appropriate evaluation and treatment. Keeping your little one healthy and preventing the spread of hand, foot, and mouth disease is a top priority. Luckily, there are simple steps you can take to protect your child and others from this pesky virus. First and foremost, instill good hygiene habits by encouraging regular handwashing with soap and water. Make it fun by using colorful soaps or singing a handwashing song together. Remember to disinfect commonly touched surfaces and objects, like toys and doorknobs, to zap those germs away. Teach your child the importance of covering their mouth and nose when coughing or sneezing, either with a tissue or their elbow. And if your little one is feeling under the weather, it's best to keep them home from school or daycare until they're no longer contagious.